Hi, I am Professor Dato Dr. Ravi Jegasoothy, the Executive Dean of the Faculty of Medicine. I am a professor in obstetrics and gynecology, the discipline that deals with all diseases of the reproductive organs of females. And today I want to speak to you about cervical cancer and the strategies for its prevention. At one time, cervical cancer was the leading killer for women in the reproductive age group, that is, between the ages of 25 to 50. Now it has dropped to the third spot. Why was that? That's because of the introduction of the cervical vaccine program in 1990 in Malaysia. And that year, the government of Malaysia decided to introduce cervical cancer vaccine in schoolgirls aged 13 and above with 2 doses. And that simple strategy has resulted in the lowering of cervical cancer incidence. What is cervical cancer? It's a cancer of the reproductive organ, and that particular part called the cervix, which is the part of the uterus that protrudes into the vagina. And it always forms in one particular area of the cervix, which is called the transitional zone. The transitional zone is that area of the cervix where there is a border between the type of cells lining the vagina, which is called the squamous epithelium, and the cells lining the uterus, which is called the endometrium. So, since it always forms in that area, one simple strategy previously was the use of the pap smear. You would have heard of the pap smear, which was advocated for many years in the primary healthcare program in Malaysia. Women were asked to come voluntarily to do a pap smear once they have attained the age of 25 and do it once every 3 years if twice it was normal. Now, although it was a simple examination which involved a scraping of cells from that area of the cervix, the take-up rate was very low. Not all women came forward, and we still had women who turned up with advanced stages of cervical cancer, and almost always they would have not done a pap smear ever. So prevention was failing. And what changed all that was the cervical cancer vaccination program. Cervical cancer vaccine uses the principle of human papillomavirus prevention. That is, we know that there are about 200 over subtypes of the human papillomavirus, but there are 20 high-risk subtypes. And this vaccine will prevent any infection by the 20 high-risk subtypes of human papillomavirus. So, by using this simple strategy, the incidence of cancer has slowly started reducing. And we find that studies of women in the later ages of life has shown that the antibodies towards human papillomavirus are built up from the vaccination program. So my advice to women is to avail themselves of the vaccine if they are in the reproductive age group and have not been vaccinated, and also to screen themselves for the human papillomavirus. You can either see a doctor or even do a self-test if you are too embarrassed to see the doctor. Just need to insert a swab into the vagina and then send the swab to an accredited lab or to the doctor. And the human papillomavirus will be screened for. If you happen to have the high-risk subtypes of human papillomavirus, then you are asked to come and see the doctor for an examination to be done to detect whether there have been any changes in the cervix. If there have been changes detected, then a simple excision or cautery can be done to remove that area of abnormality. And that simple strategy will prevent the onset of cancer. One fact that the ladies should remember is that cervical cancer develops over a long period of time. So from the time you have had infection by the human papillomavirus, it may take from 5 to 10 years before you manifest yourself with cancer of the cervix. So that gives you enough time to seek early treatment. And the importance of early treatment is that cure can be almost 100%. And it is a simple treatment modality of taking out that transitional zone. That you do not lose your reproductive organs. And the surgery is a minor type of surgery compared to if you have actually had overt cervical cancer or a growth in the cervix, which is large. And the other important fact is that survival is much, much better. As I said, almost 100% compared to, say, 20% if cancer is advanced. So, what is the message I'm trying to provide to you? Screen yourself for the human papillomavirus. Have the cervical cancer vaccine if it is available to you. And always be aware that cervical cancer can kill. Thank you.